My mother is the person who inspired me to become a nurse. She was a nurse for over 25 years, and just seeing her get up, go to work every day, day in and day out, taking care of her patients, it was very inspiring to me. And I also saw how rewarding it was through her. So that's kind of when I had my aha moment, and I thought to myself, I want to help people just like that.
I actually wanted to be a nurse for as long as I can remember. But when I was 15 years old, my mom got pregnant with my brother, and while she was in labor, she had these tumors that burst and she was bleeding to death. And that whole experience really made me interested in the medical field, which is why I chose nursing.
My grandmother inspired me to become a nurse. I remember going to Louisiana during the summer and going to work with her as a caregiver to a longtime client that she currently still has. I remember being able to help her care for this person and just having such passion and joy. I knew I wanted to go in the medical field, and subsequently that just ended up me being a registered nurse.
My dad inspired me to become a nurse. When he was living, he had diabetes, and I can remember as a little girl, he would always allow me to assist him with his insulin injections and checking his blood sugars and stuff like that. And I always felt like I was taking care of him when I was doing those things. So that inspired me to go and pursue my career in nursing.
Initially, when I was a kid, my grandmother actually used to take me to nursing homes, so I always enjoyed being able to help people. I learned more getting into the medical field that the nurse was actually the person that's right there at the bedside with the patient. So then that's what led me to say that I wanted to be a nurse.
Our very best nurses, they have to have the great clinical skills, but they also have to have a really compassionate nature, because as the saying goes, people don't care or remember about what you said or what you did as much as how you made them feel.
It was a young lady. She was like in her early 30s. She was involved in a car accident, and she ended up being paralyzed from the waist down. And she was in the hospital for a very long time. She was sick, but she became, that was my girl. Like, that's where my compassion sticks, because when I take care of her, like just knowing the difference that I made, like showing up and being compassionate no matter how tired I was, or I knew that me taking care of her made a difference.
I remember one time there was a young mom who was succumbing to her illness with COVID. And the only person that could be there with her was the nurse, and it just really touched me. It reminded me of the extreme privilege and responsibility that nurses have for patients that nearly no other profession has. And that has really impacted me going forward.
Wherever nurses are, there's a difference made. The patients do better. The nurses intervene on behalf of the patients and help provide that collaborative care for the patient. And it really just elevates and escalates that patient care, that patient experience, and improves patients' outcomes.
Working at Harris Health System has been an amazing journey. Their willingness to take ownership in their practice leads to better patient outcomes, better patient satisfaction. It gives them that point of engagement and empowered to drive the change that we want to see in Harris Health System. And they're leading us to that, to become a high reliability organization.
Even through those hard days, those difficult times, even through the times we have to say no to some things, know how much we care and love our nurses.
Thank you. Thank you for everything you do every day for our patients. Thank you for everything you do every day for each other. Thank you for everything that you do to represent Harris Health and our mission. And thank you for continuing to show up in every way, every day. Happy Nurses Week.
Happy Nurses